Okay, everyone, this is going to be a very quick review of the endocrine system. You learned about this in anatomy and physiology, and so if you don't remember much about endocrine, this short review should sort of kickstart your thinking, but it should also cause you to go back into the book and read more if there's more that you want to learn. Your text for this course does a very nice job of giving you a brief overview of the endocrine system. Okay, so let's just do a brief review here. The endocrine system really is all about homeostasis. And remember, homeostasis is about maintaining a stable environment for life. So stable hormones, stable fluid levels, stable oxygenation, stable pH. So that's what this system helps control. Hormones are the chemicals or the mechanisms by which the endocrine system controls homeostasis. So if you'll remember, hormones are chemical messengers and they're released in response to a change somewhere in the body's internal environment. Okay, it's like a trigger system. And then the endocrine system, like many other systems in our bodies, uses feedback loops to regulate body processes through either the upregulation, which is an increase, and or the downregulation or decrease of hormones. So it's sort of like having a controller switch. We can say more, less, but the body is doing that on its own. So here's a really good example of a feedback loop. We're going to start over here with this beautiful cupcake. So we have a cupcake, and the cupcake, after being eaten, causes blood sugar to rise. Well, when blood sugar rises, the beta cells in the pancreas release insulin, this guy right here, into the blood. And then what happens is glucose either goes into the cells of the body because insulin acts like a little gate and opens the door so that glucose can go into the cell, or the liver can actually take up excess glucose and just kind of hang on to it for future use. So when this all happens, then the blood glucose level declines and we're back at homeostasis. Now, let's take an opposite feedback loop. Let's say it's now 11 o'clock in the morning, you ate breakfast at 7, you're starting to feel really hungry, you're sitting in pharmacology and you're like, oh my gosh, I could eat my left leg, I'm so hungry. So you're hungry, your pancreas, the alpha cells, okay, in the pancreas release glucagon. Glucagon then tells the liver, hey, I know you stored some glucose in here as glycogen earlier. We need it now. So the liver releases, breaks down the glycogen, turns it into glucose and releases it into the blood. Blood sugar rises. We're back to feeling better. So I don't know if you've ever had that experience where you're super hungry and you just feel like, you could eat anything in sight, and then that feeling will kind of pass and go away if you can avoid eating, or sometimes you don't have a choice. And that's what's happening here is the body's saying, okay, I need glucose, I'm going to get it some other way other than from food. So pretty elegant little system here to maintain our blood glucose. Why do we need to maintain our blood glucose? Because our cells need it for energy. So as we think about hormone therapy, there's 3 main ways that hormones are used or that we manage hormone therapy. So one is we replace a hormone that is lacking in the body. And probably the best example of this is thyroid hormone, right? You have a thyroid that is either not producing enough thyroid hormone or maybe has, conked out altogether. And so you take some thyroid hormone every day. Now your body has what it needs. Another great example is insulin. People with type 1 diabetes who do not make insulin need insulin. So we can give insulin. Estrogen, testosterone, another example of that. Corticosteroids. I know that sounds really crazy, but we can use corticosteroids. Somebody needs them for a particular disease, we can give those. Most often we're using them therapeutically. We're sort of exploiting what they can do rather than using them as a replacement. But there are people who don't make enough corticosteroids and they have a disease called Addison's disease. And without exogenous corticosteroids, they will die. Growth hormone, to think of people who maybe have short stature. Now you have to look at it and see, is this like genetically inherited short stature or, are both parents of average height and now you have a child who is much lower or below average height and there's some desire to help them grow a little bit taller just again for social, physiologic reasons that you want them to be more within the norm. And so growth hormone can be given. Very expensive, by the way. So that's one use of hormone therapy. Another is to produce an exaggerated response. And this is what I was talking about with corticosteroids. And our example here is hydrocortisone. So we know that the corticosteroids are excellent suppressors of the immune system and hence inflammation. And so we can give way more than what the body normally makes on a day-to-day basis and get this profound anti-inflammatory effect. However, that messes up other hormones. And as we all know, corticosteroids come with a whole host of other adverse effects. But in the presence of really potentially life-threatening inflammation, they can be very therapeutic. And then the last use of hormone therapy are anti-hormones. And the place you might be most familiar with this is maybe if you've had a family member or friends of family members who have had estrogen dependent breast cancer, meaning their breast cancers actually rely on the hormone estrogen in order to make more of the tumor. And so if you can cut off estrogen or block estrogen from those tumors, you can cause those tumors to shrink, certainly prevent future growth. And the example here is tamoxifen, which is a drug. It's basically an estrogen receptor blocker. So those are pretty much the common uses of hormone therapy. And for the purposes of this course, we are going to do a deep dive into diabetes and using insulin. But you will learn in other classes and as you continue on through nursing that hormone therapy is pretty common and can be used to treat a number of diseases. So just so you kind of go back and review the physiology, this is where I highly recommend that you look at your text, specifically the text on drugs for pituitary, thyroid, and adrenal disorders, and read just the beginning part that talks about the pathophys. But there are two main organs, if you will, apparatuses that help control hormones. And the first one is the hypothalamus. So the hypothalamus is the one that secretes what's called releasing hormones. And these releasing hormones travel via the blood to the pituitary gland. And it tells the pituitary gland, hey, you're a little low on thyroid hormone. You need to give to some more of that. Hey, you're a little low on growth factor or testosterone or whatever, and it will do that as well. Now, endocrinology, or the study of the endocrine system, is actually quite complex. So I'm keeping this very simple for you. But I think the other thing that you need to know, so this doesn't cover all hormones, but we do happen to call the second apparatus, the pituitary gland, the hormone control master. So again, doesn't control every single hormone, but controls many, many hormones. So I have them listed here. It's the anterior lobe of the hormone that is the master switch. And literally by stimulating this pituitary gland through the release of the secretion of these releasing hormones that the hypothalamus releases, the pituitary will then say, okay, I just got a message. I need to increase more estrogen to the uterus. Okay. So that's how this occurs. And I certainly don't expect for this particular topic for you to know all of the various hormones that are controlled by the pituitary gland, but I do expect you to remember that the pituitary gland is the master switch, the master control. So here's a great depiction of what the pituitary gland controls. And you can see up at the top the two little blue things that look almost like headphones. That's the hypothalamus, right? And then it comes on down and feeds information to the pituitary. The pituitary then releases other hormones. So very, very interesting. The last thing I want to say before we move into diabetes-specific discussion is things that can affect the pituitary or hypothalamus can also affect hormone release. And I think sometimes we don't think about this. We know that the pituitary gland controls these things, but what happens if something happens to the pituitary gland? Well, we can end up having problems. The patient can. So things to consider are things like tumor of the pituitary gland, an injury, something like a head trauma, or child is thrown from a bicycle maybe and hits their head on the pavement, and all of a sudden now they can't regulate their fluids, their body fluids, right? That probably is a result of having an injured pituitary gland. You can have diseases that affect the pituitary gland itself. And then lastly, medications. So medications that affect the pituitary, which in turn would affect all of these hormones. So something to think about. Our bodies are very complex, and if something's happening and there's really no explanation for someone who is exhibiting diabetes insipidus, where they're just like urinating every ounce of fluid they have despite not taking in much fluid, that's something that would sort of stop you to say, oh my goodness, maybe we have a problem here in terms of the pituitary gland. That's actually a common thing that can happen after a head trauma. Okay, that's it. I hope this little overview kind of gets you into the mindset for our next discussions.